These things happen between brother and sister. This was how I was dismissed when I tried to disclose the abuse by my brother the second time. The first time I tried to disclose, 18 years after it had happened, the person said to me, "Don't make this into something bigger than it is." By this point, I'd barely said one sentence, but what it had included was my brother was 12 and I was 10. That was enough for that person to dismiss me. These kind of offhand, dismissive, judgmental comments shut me up, made me feel small, amplified the shame, confusion and isolation I was already feeling and carrying inside. That first time shut me up for another 6 years. The second time, thankfully, I was able to open my mouth later and challenge what was said, and this was well received. But that's because I'd spent time building up my internal resources. These comments, dismissive and judgmental, are dangerous and just intensify those feelings inside that we're wrong or bad in some way. I would ask that all professionals listen. Hear what is being said to you without judgment. Hear the feelings, the experiences, the thoughts of that person. Hear and listen to what they are trying to tell you. Do not judge. All I would have wanted was someone to do that, to listen, to say to me, "I hear you." It would take another 8 years before I'd be able to reach out again. Another 8 years of holding on to the shame, confusion and hopelessness. By this time I was in my 40s. But this time, thankfully, I was received without judgment. I was heard and the abuse that happened was validated.
So without any ado, I would like to welcome Amelia, Chrissy, and who we are calling A, to this session, which is around working with adult survivors. It's going to be moderated, and I've developed some questions for them that have also been slightly designed as well through people writing into the conference in the last couple of weeks. So the session is around how best to work with adult survivors of sibling sexual abuse. And I would actually like to start off by asking Amelia and Chrissy and A to introduce themselves. So Chrissy, could I ask you to introduce yourself, please?
Good afternoon, everyone. I'd like to start by saying thank you for all the presenters today sharing their wealth of knowledge and expertise, in particular the courage of the survivors who've been able to speak out and give voice, and to all of you as the participants in this very under-researched and underreported area of complex trauma and childhood sexual abuse. My name's Christiane Sanderson. I'm a senior lecturer in psychology at the University of Roehampton, and I have 35 years experience of working with survivors of childhood sexual abuse and complex trauma. I'm also a charity trustee at 1 in 4, which is a specialist service in London that offers low-cost counselling for up to 2 years. They have published a self-help book on working with survivors of childhood sexual abuse. And I'm just in the process of publishing my latest book, which is actually on sibling sexual abuse. The organisers of the conference have kindly allowed me to include a draft chapter on working with survivors of childhood sexual abuse, which should be in your information pack post-conference.
Thank you, Chrissy. And Amelia, could I just ask you to quickly introduce yourself?
Hello, I'm Amelia Anning, a research associate specialising in sexual abuse and an associate lecturer in criminology and psychology at the University of the West of England.
Thank you very much, Amelia. And A, could I ask you to introduce yourself, please?
Hi, yeah, I'm. You can call me Amy. It's fine. I'm Amy, and I have lived experience of sibling sexual abuse. I'm a project officer on the Rape Crisis England and Wales project, and I will be undertaking PhD research in September to look at the quality and dynamics of sibling relationships. in the context of sibling sexual abuse.
Thank you, Amy, and welcome everyone. So the first question that I would like to ask actually goes to Amelia. Amelia, I know that you have done some research on best practice in supporting adult survivors, and I was wondering what you think are the key findings from that for frontline sectors.
So I worked on the Bristol side of the project with the University of the West of England, and our research focused on the impact of sibling sexual abuse on adults who are harmed as children. So we spoke with both adult victim survivors of childhood sibling sexual abuse and practitioners who would typically come across people who've been sexually abused by siblings from across England and Wales. So the project focused on a gap in the evidence base around the reality and impact of sibling sexual abuse, with particular attention being paid to the reality of disclosures and the support afterwards. So I'm going to give a brief overview of the results from the project and then talk about my experiences of conducting the research. So we interviewed 18 victim survivors, only one of which male. Around 60% did not identify as heterosexual. And there are a wide spread of religious beliefs. 80% were white British, and most people did not identify as having disabilities. We also interviewed 12 professionals who had typically encountered those who had been sexually abused by siblings, from counsellors to police to ISFAs, from all across England and Wales. So I'm now going to briefly talk about the findings and our recommendations, including kind of considering family dynamics, understandings of what sibling sexual abuse is, considering long-term implications, support for dual status individuals, female abuse of siblings, and the need to educate and inform. So the key difference between child sexual abuse and sibling sexual abuse is the family dynamics. So with sibling sexual abuse, victim survivors experience kind of more varied long-term difficulties than childhood sexual abuse survivors would usually experience. So there's also significant parental dysfunction within sibling sexual abuse, with many parents knowing but not realising that the abuse is happening, and others knowing but choosing not to act. So the victim survivors often spoke about the functional dysfunctionality of their family systems. Therefore, we need to work better with families, both during and after the abuse takes place. There's an issue in understanding around sibling sexual abuse, including the language used. Many victim survivors thought that their abuse didn't count as sexual abuse, as there was often no penetration involved. And they actively sought to differentiate themselves from the childhood sexual abuse label, which often resulted in challenges and problems around the availability, fit, and acceptance of treatment or support. Therefore, we need to develop clearer recording criteria and definitions of sibling sexual abuse. So there are significant long-term implications for many sibling sexual abuse victim survivors, with most experiencing some form of mental health issues and problems around the formation and maintenance of interpersonal relationships. So the victim survivors discussed how sometimes professional engagement had negatively impacted their ability to form relationships, as they often felt that they weren't listened to after struggling to speak up in the first place. Therefore, we need to upskill professionals around sibling sexual abuse and create specialised support for victim survivors. So the research explored the reality of people with dual status. So this is where kind of young people have harmed who then go on to harm, who have been harmed who then go on to harm, and kind of the impact this has. So the research found that many victim survivors of sibling sexual abuse had been abused by a sibling who are victims of abuse or trauma themselves. So we need to kind of figure out how to better work with these individuals. There are a large proportion of female abusive siblings, which was something that was mentioned a bit earlier on, which challenges preconceptions of familial sexual abuse, showing that sexual abuse is not inherently linked to gender. So we need to be kind of cautious in not generalising sibling sexual abuse and be open to listening to victim survivors. And finally, we need to inform society about the realities of sibling sexual abuse. The victim survivors felt that the general understanding of sibling sexual abuse and even sexual abuse more generally was poor across society and was not helped by media, policy, and professional framing of the issue. So you'll be able to access this report shortly and kind of read a bit more about that in depth. So this was my first proper research project as an early career researcher. So I got stuck in quite early. And one thing that struck me was how strong and powerful the victim survivors I spoke to were. Everyone was so open, honest, forthcoming, something of which I was incredibly grateful for. And we wouldn't be here today had the victim survivors not come forward and shared their stories and recommendations. I was struck by the relative lack of understanding from professionals. So prior to my career in academia, I worked in clinical practice, and I'd never knowingly come across sibling sexual abuse. However, looking at statistics, it's highly likely that I've come across multiple people. So I can understand how practitioners might not consciously be thinking about these things or understanding the nuances kind of without having experience in that area. Another thing that stuck with me is the idea of normative sexual play, which again has been mentioned earlier. So this is something that Chrissy has written about previously, kind of exploring what constitutes as normal within sexual exploration at a young age. And I found many victim survivors kind of not seeing their abuse as abuse at the time because they either kind of thought it was normal or they were told it was normal by kind of parents, by surrounding professionals. So I think this is something we need to be mindful of. So we had difficulty in recruiting because it's obviously quite a contentious area. So a lot of the victim survivors had come to the realization that they'd have been abused later in life, most of whom seeking counselling for secondary issues, only to later discover that kind of repressed trauma. So this would obviously skew kind of who we could speak to. So we did gain kind of a specific sample, which we need to bear in mind. So I think the most important thing to consider is that we're all different. We all have different experiences and we all react differently to those experiences. So this is something that needs to be contemplated by us all. Thank you.
Thank you, Amelia. That was really, really interesting. And I know that a couple of people have asked around whether the research that you've done will be shared. The answer is yes, it will be. And I'll talk around at the end of this around some of the other research that's coming through. So I'd like to build on that and talk to Chrissy. And Chrissy, looking at your experience and what you've done over the last 30 years and the research, I was wondering if you could talk to us, please, around what do adult survivors of sibling sexual abuse need therapeutically?
Okay, thank you very much, Amy, for sharing that. And thank you to Amelia. I'm really pleased this research is being conducted because I'm going to echo much of what the research has shown. And it's really important that this research gets much wider coverage. So I'm going to echo very much what has been said throughout the day in various different contexts, but I want to just flesh a number of things out that perhaps we haven't had a chance to explore fully. So firstly, it's absolutely clear from all the presentations today, both survivors, experts, as well as professionals, that SSA is very complex and it occurs on a spectrum, which includes a range of motivations, experiences, impacts and outcomes. So what we need to be aware of throughout, which has been alluded to, is that survivors of sibling sexual abuse are not a homogenous group. This is crucial when it comes to therapy, because that tells us that no one cap fits all in terms of the therapeutic treatment modality that we might present. One of the things to bear in mind that in any type of abuse or violence and power and control, people are not given choice. They're not allowed to have autonomy. And so one of the things that's critical when we work with survivors is to ensure that the model we use is cognizant of that and ensures that we give back choice, autonomy, and power to the survivor. So we need to be flexible in how we work with adult survivors. The second thing is that sibling sexual abuse, as in child sexual abuse, doesn't end when the harmful sexual behavior ends. It continues. Amy has really highlighted that in terms of fear and consequences of disclosure, the ripple effect in the family. But one thing I'm very mindful of with any type of childhood sexual abuse, sibling sexual abuse, is that often these are referred to as historical cases when adult survivors come forward. But you know, they're not historical cases at all, because the actual dynamics of the sexual abusive experience continues into the present. It remains online. The fear of being in relationship, the fear of sexuality and intimacy, the fear of the shame and being found out that this has happened to them. So we cannot relegate it to the past. We need to recognize what is still going on in the present, what has remained online. So one of the things we need to do is, as practitioners, is to be aware of the wider long-term effects. Such things as, for some survivors, it will mean they will develop complex trauma. And that is to do with the repeated systematic abuse on a daily basis, living in close proximity to the abuser. This can generate complex PTSD. But there's also the shame, the self-blame, the sense of having been complicit in the abuse, the awareness of the confusion. Was it abuse? Was it not abuse? This can distort reality. And we absolutely need to be aware that that continue, as some of our survivor experts have told us, that can carry on for 20, 30, 40 years. So it's really important to be aware of that. And we need to be aware of the dissociation. The younger the sibling, the greater the chance of dissociation, and they're much less likely to remember in any detail what's happened to them. So they then fear that their recall is inadequate and therefore they can't legitimize their abuse. So we have to be aware of that. It's too easy to say they have depression or they have anxiety. We need to really delve deeper, the dynamics underneath that absolutely are intrinsic in sibling sexual abuse. So there'll be a changed perception of the self, there'll be emotional dysregulation, the lack of distress tolerance. And the big thing that I always am mindful of people, and I would include those of you who work with children, when there is abuse, sexual or physical, in an interpersonal relationship where there is a prior relationship, this creates a belief and a sense that relationships are dangerous. Relationships are not places of comfort, they're places of fear. And this includes the relationship with us, the professionals, the relationship with a therapist. So when many survivors, adult survivors, come into therapy, Amelia was quite right, they often don't realize they were sexually abused, or they come in and with a different presenting symptom. But one of the things they will do is they will fear this relationship, because relationships are dangerous, which means they might dissociate. And this is one of the reasons I'm going to mention in a moment, the importance of what we call a phased trauma approach, right, in terms of how we work with survivors. So one of the things we need to do is, in terms of good practice, is first of all, and this has been iterated many times today, have a good understanding of the nature of sibling sexual abuse, including, as Amelia said, the dual harm. And what we need to be able to do is we need to bear witness without judgment. And we need to do this in a non-prescriptive way. And I'll explain that in a little bit more detail. In order to help us to do that, we need as much training as we possibly can. And I do a lot of training in this area because more and more people are coming forward with this presentation, and there's a desperate need for that. Now, the second thing is, and this has been mentioned by all of you, is an understanding of typical and atypical sexual development. But we need to have a broader understanding of psychosexual development in children right the way through to adulthood. And that doesn't just mean the behavior, but we need to understand the cognitive stage of development the child is at in terms of their capacity to make meaning. And then we also need to understand the stage of development in terms of sexual maturity, sexual knowledge, and the behavior. So we need a much more comprehensive understanding than just the behavior. And I should just add there, this includes us too. We need to be aware of that so that we can use psychoeducation in the way we've been talking about today. But you know, we also need to be aware of our own relationship to our sexuality and sexual being. We need to feel comfortable with that. And one of the things I've promoted, as Amelia said in some of my work, is actually the capacity to be able to talk about sex. And although we live in the 21st century and we can look at sex 24 hours a day, every single day of the year, this is not accompanied with meaningful discourse around sex and sexuality. And I often find even professionals find it hard to talk about their own sex and sexuality, never mind parents. And until we feel comfortable about listening and hearing about sexual themes, about sexual abuse, and have knowledge and awareness of our own sexuality, this is very, very difficult for us to respond appropriately. So we do need to delve into our own experiences and feel comfortable talking about sex. So the other one that is absolutely critical, which has been mentioned several times today, is the recognition of power and control dynamics. Now, these are not just the intrinsic power and control dynamics in most families, if not all, but also between siblings, but also on a systemic level across society, race, culture, gender, marginalization, the stigmatization and intersectionality. So we have to have a recognition of that, not just the family. It has to be broadened out. So what I'm going to propose, in the way that I work with survivors of both childhood sexual abuse and sibling sexual abuse, is to look at the therapeutic modality that you use. And in order to recognize these power dynamics and to minimize them so they're not reenacted in the therapeutic process, we need to adopt three things. One, the power threat meaning framework, which is an alternative framework, diagnostic framework, as an alternative to psychiatric diagnosis, and which avoids pathologizing the individual. We need to have an understanding of trauma-informed practice, and then a phased approach to the treatment of trauma. So, as I said, the power threat meaning framework is an alternative framework, and the emphasis is on tell me what happened to you, not what is wrong with you. But most importantly, the symptoms that we see, both in children and in adults, are seen as adaptations, as accommodations to living in an environment where there are threats, where there's the misuse of power and control. So rather than pathologizing those symptoms and medicalizing them, we need to see them as adaptations. But we also need to look at, what did the survivor have to do to survive? They had to lie. They had to keep the secret. They had to change their personality. This doesn't mean to say they have a personality disorder. This means they had to engage in certain things in order to survive their experience. And the other thing we have to do is to be aware of what meaning they made of that. And as we've heard today on numerous occasions, they often don't make meaning because they're too young or they are confused about what's happened. In adopting this framework, we can validate and legitimize the survivor's experience. Now, this is in line with trauma-informed practice. And the principles, I haven't got time to do them all in detail, sadly, but the principles, the core principles of the trauma-informed practice is, firstly, do not make assumptions, see the trauma through the eyes of the individual, okay? Not assuming, not generalizing. The second thing is to create safety in the present and be aware of risks that might have had a ripple effect from earlier childhood, where there's still maybe no sexual harmful behavior, but there may still be power and control dynamics coming from the family and the sibling who harmed. We need to be trustworthy. And most importantly, we need to work in a collaborative, non-hierarchical way in which we promote choices and autonomy. And the emphasis throughout is on empowerment, the empowerment of the survivor. Restore, reclaim the power that was stolen from them in childhood. And then pacing is incredibly important, to go at a pace that is manageable for the survivor. And here we advocate what's called a phased-oriented approach to trauma. I would suggest this is also really important when working with children. When I first started 35 years ago, all the advice was somebody makes a disclosure and you get straight into the detail of the abuse. Tell me about the experience. It was believed to be cathartic. I consider this, and many of my colleagues consider this, to be unethical today, because it often just re-traumatizes the individual. So pacing is everything at a manageable pace. And the phase-oriented model allows us to do that. It has three phases. The first is stabilization. And here we work with the child, with the adult, to learn about emotional regulation. How can they learn to regulate the emotional valence of the trauma symptoms, the confusion, the distress? And in helping them to do that, which includes psychoeducation, they can then develop distress tolerance. This allows them to go into phase 2. And in phase 2 is where you explore the traumatic experiences in more detail. It's a process of realization what happened, a legitimization of what happened to them. It's also an opportunity to go over recurring themes such as shame, self-blame, self-hatred, and self-loathing. And it's also an opportunity to work towards loss and mourning, loss of that childhood, loss of the sibling who abused them, loss of the family, if that is what's happened. And then this then leads into phase 3, which is integration. And here, integration is about consolidating all the skills and all the knowledge accrued in phase 1 and 2, and putting that together to develop even more meaning. And from that, they can move into what we call post-traumatic growth, which is possible, and we need to be hopeful of that, where they can start to connect to themselves, to others, and to the world. Underpinning these 3 particular models is the power of the healing of a therapeutic relationship, which needs to promote inclusivity rather than othering. It needs to have cultural humility, empathic and compassionate. It's got to be based on mutuality, being in sync and mirroring and working through this together. And this allows them to build relationship skills, setting boundaries, being able to express needs without judgment or shame. So, in conclusion, there is hope for the future recovery and healing. And I was very struck by Amy's beautiful example of the shattered glass. And some of you may know this metaphor, kintsugi. And what kintsugi is a Japanese art form in which, in the 17th century, when porcelain got broken, they didn't have araldite or super glue in those days, so they took it to a restorer, and the restorer would restore it with real gold. And then these broken vessels that had been beautifully restored became even more valuable and more expressive than the perfect, pristine vessel. And we need to think about that in the work that we do. Hope, there is hope, and there is recovery. Last but not least, please, please, please look after yourselves. It is essential for you as practitioners to engage in self-care. And this will range from supervision, especially with someone who has a knowledge of trauma, and that will help to minimize the impact of vicarious traumatization. But it also includes resourcing yourself with knowledge and training, and very much what we've been doing today. So please, please carry on the great work. It's desperately needed. But look after yourself so that you can be available to the people that have been most hurt and damaged. Thank you.